Hello and welcome to Health Professional Radio. Thank you so much for joining us again. In this segment, we're going to be speaking with Dr. Rohit Dhall, Associate Professor of Neurology and Director of Neurodegenerative Disorders at the University of Arkansas. And he's joined by Beverly. She's been using a device called Cala Trio to treat her condition. Dr. Dhall and Beverly will tell us all about this device. And welcome to the program, both Dr. Dhall and Beverly. Thank you for taking the time this evening.
Thank you for having us.
Well, Dr. Dhall, if you would give us a bit of your background. Of course, I did mention your position there at the University of Arkansas.
I'm a neurologist with specialized training in movement disorders, so disorders that affect the motor control of individuals. Usually, these are disorders that affect our older population. And I've been here practicing in Arkansas for the last 4 years. I've directed centers of excellence in two of the previous positions that I held in Northern California and in Phoenix, Arizona.
And Beverly, a bit about yourself, if you would.
I'm 73, a retired RN, and I inherited essential tremor. I'm one of 4 children, and 3 out of 4 of us have ET. My mother's side of the family, back in Georgia, where we came from, many people had essential tremor, and I just inherited it like my sister and brother and so many other of my relatives, unfortunately.
Dr. Dhall, how would you describe essential tremor to your patients? What exactly is ET?
So essential tremor is one of the most common neurological disorders that we see in our movement disorders practice. About 7 million people in the United States live with ET, about 70 million people worldwide. Tremor is rhythmical shaking of both hands when you're trying to do stuff with your hands. And essential tremor is diagnosed by the detection of this rhythmical shaking or tremor during hand use, during the kinetic portion of hand use. For example, when somebody's writing, eating, using tools, or grooming themselves. Essential tremor is quite common in the population, but it constitutes a smaller fraction of my practice, of a movement disorders practice. It's dwarfed by how much Parkinson's we see. And I think it's because many people with essential tremor, they stay with their primary care physicians or do not seek care for their tremor, even though 1 in 4 would report that tremors impair their day-to-day living. And about 1 in 20 would report that it limits their day-to-day living significantly. Many activities of daily living are either impossible or require assistance. People with essential tremor also have a higher rate of anxiety or depression. Alcohol use rates are higher in people with essential tremor, just a coping mechanism to cope with the tremor itself. Although we don't know what causes the essential tremor, as Beverly said, she inherited it, and we know that it's inherited in an autosomal dominant fashion for many of our patients, but we don't know what the specific genes are that are associated with the inheritance of essential tremor.
Now, we're going to talk about a new wrist-worn bioelectric device called Cala Trio that treats this condition. When in a patient's journey with ET would you prescribe Cala Trio?
Right. So let's to address that, let's briefly talk about the treatment options for essential tremor. Before Cala Trio became available, the treatments that we had were medications. There are a couple of groups, medicines called beta blockers that are used for managing blood pressure and heart rhythm issues, and anti-seizure medicines or anti-epileptics. They have been the cornerstone of treating essential tremor that is mild. And about 2 out of 3 people would report benefit from using medications on their tremor. The 1 in 3 that do not have benefit or don't have sustained benefit at least, It used to be that we would take them through surgery. We would take them through specific brain surgical procedures that became available in the mid-1950s, 1950 onward, and have become more and more refined and precise as time has gone on. But nonetheless, we would take them through surgical procedures to address the tremor if it was severe and causing impaired day-to-day living. And many people would be scared of going through surgery or would, for various reasons, opt not to go through procedure, either because they couldn't access a center with expertise or didn't feel that the tremor was bad enough for them to go through that. So Cala Trio, it's a neuromodulation device. What the device does is sends electrical impulses that are taken by the nerves into the brain and processed in the brain to try and quiet down the tremor. And in some ways, it works like brain stimulation, neuromodulation, but instead of putting wires in the brain, we're using wires that God created in the nerves of the hand, for instance, to help calm the tremor down.
Now, is this significantly more efficient than medication?
The answer is no. Actually, the proportion of people who would benefit from the Cala Trio device, based on the studies that I've been involved in, we were involved in a randomized controlled trial looking at a single session of Cala Trio therapy. It used to be Cala 1 therapy in people with essential tremor, and then a large open label study. What we understand is it's about equally effective as medications. Cala therapy is about equally effective. About 2/3 of our patients would notice improvement in the tremor severity with the Cala Trio therapy, as would our patients. 2/3 of the patients would notice benefit with medications. There are specific, advantages to an on-demand therapy like Cala Trio, where you could choose when you want the benefit and when you want to kind of hold off on the therapy. And I think Bev might be able to talk more about her experience and when she, essentially chooses to use the device to stimulate.
What about some of the side effects?
So the medications that we use, as I said, they belong to two big groups. One is beta blockers, and the main side effects there are a drop of blood pressure or slowing down of the heart rate that can cause people to feel tired or poop out easily when they try and do aerobic activity. In people with COPD or asthma, the beta blockers can increase the risk of breathing difficulties. The other group is anesthesia medicines, and the most common side effects there are sleepiness, somnolence, and impairment of balance with a risk of falls. And there are some other lower frequency side effects, for example, impairment of mood, etc., that we have to be careful with some of these medications on.
Beverly, I understand that you say you inherited this condition. Did you know about ET before you were diagnosed, and when did you first think that you had it?
Oh, I think I've always just kind of had tremor, but it became problematic at middle age. Mm-hmm. When I was younger, the tremor was not such a problem, and I didn't have that much trouble with fine motor. But then I began to need drugs and beta blockers and Primidone, and I tried other drugs too. Eventually, the side effects became limitations on dosages, and I still continue to take drugs, but now instead of going for a PRN Klonopin, whenever my tremor is out of control, I put on my Cala Trio and use that instead. It's my go-to. I turned down DBS surgery in about 2015. My neurologist recommended it. But whenever I got enough details about some of the issues around it, I was unwilling to proceed. And so I went to a support group instead. And at the support group, the Cala Trio people came and described the device even back when it was in development. And I thought, that's what I need. And so when it first became commercially available about a year ago, I got my neurologist. I was his first patient, and he's a movement disorder specialist in Seattle. And I found that it is really helpful. It doesn't fix my tremor. It doesn't cure me, but it modulates, it moderates the intensity. And I'm able to use my hands. And also I have that central tremor problem where my speech is affected. I have the dysarthria and the dysphagia, and the Cala Trio helps that too. Wow. And so finding that I need less medicine, I need a whole lot less of the PRN benzodiazepine, and I just, it's improved my life. Right. It's great. It's a miracle.
Good to hear. Good to hear. Dr. Dhall, in wrapping up, give our listeners a website where we can learn much more about Cala Trio.
I think there are a couple of resources that I would point to. The first one is the website for knowing more about essential tremor. It's the International Essential Tremor Foundation website. The Tremor Foundation's website is essentialtremor.org, essentialtremor.org. And if you go to the website, they do talk about living with essential tremor, including resources. And amongst the treatments, they do highlight Cala Trio as a treatment option. It'll direct you to the Cala Trio website, the company that makes the device, its website. There are resources on the International Essential Tremor Foundation's website about other types of treatments, including medications and surgical options. And on Cala Trio's website, which is CALATRIO.com, there is additional information about what the device does, what some of the data are pertaining to the use of the device, both for patients to review and for healthcare professionals. And as a disclaimer, there are several of the trials to develop Cala Trio that I was a part of, and so some of those I have been involved in reporting to the international audience, both as a co-author on some of the papers and as presenter of some posters and platform presentations nationally and internationally.
Well, I appreciate you both joining us here on Health Professional Radio this evening, both Dr. Rohit Dhall and Beverly.
Pleasure to be here. Thank you.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.